Well, good morning, Central Jersey. How are you today? Great to have you with me once again. I'm Dr. Derrick DeSilva. As always, it is a pleasure to sit in and spend part of your morning with you. A very happy holiday weekend to you. We have, and this gentleman's going to be on and coming on after the 15 break. We're going to be spending some time today speaking about your eyes. And one of the biggest names, in fact, the biggest name in this area and probably in all of New Jersey, and I know even in this country, he's very well known, Dr. Jaime Santamaria from the Santamaria Eye Institute. I've known of this gentleman and had the pleasure of meeting him when I first started my practice many, many years ago. So we're going to be bringing him on after the first break. So if you've got any eye questions, whether it be macular degeneration, should you have LASIK, do you have cataracts, all of those important issues, Dr. Santamaria will be with us for the rest of the program today. So get your questions ready, get yourself ready, and he will be able to and will answer all of those questions for you.
There has never been a better time to live free of glasses. Dramatic breakthroughs in cataract surgery may give you the best vision you've ever had. No more stitches, patches, or injections. Dr. Santamaria from the Santamaria Eye Center, with offices in Perth, Amboy, and Edison, has been named one of New Jersey's best doctors by New Jersey Monthly. Dr. Santamaria is board certified with over 30 years experience. Dr. Santamaria also performs bladeless custom view LASIK surgery to see without glasses. Castle Connolly named Dr. Santamaria one of the top doctors in the New York metro area. The Santamaria Eye Center is a progressive and complete eye center using state-of-the-art equipment and procedures to assess, diagnose, and treat your eyes. Make Santamaria Eye Center your partner in healthy vision. To learn more about the cataract treatment that allows you to see far and close without glasses, contact the Santamaria Eye Centers located in Perth, Amboy, Edison, and online at santamariaeyecenter.com. The Santamaria Eye Center. Excellent vision comes from excellence.
Central Jersey Talk Radio. Central Jersey 1450 WCTC. Talking with you all weekend.
Well, good morning, Central Jersey. Once again, I welcome you back. Sitting on my left, sitting on my right, let me introduce him first, is Dr. Jaime Santamaria, and it's a pleasure and an honor to have Dr. Santamaria here with me. I've known this gentleman. I've been in the area here since 1985, and I have known this gentleman since then. He is one of the most respected, one of the most outstanding physicians in the area, not only as an ophthalmologist, but just as a person. Dr. Santamaria is board certified by the American Board of Ophthalmology and a fellow of the American Academy of Ophthalmology, as well as a fellow of the American College of Surgeons. He is on the surgical staff of Will's Eye Network Surgical Center, the Surgical Center of New Jersey, and he's also currently certified by the American Board of Eye Surgery. He teaches at Columbia University. He's in the area. He's well known. Dr. Santamaria, welcome to the program.
Well, thank you very much.
It's a pleasure to have you here with us. Tell me, first of all, a little bit about what the difference is between an ophthalmologist and between an optometrist.
Well, they're both eye care providers. They're both licensed. They're both able to diagnose and, in some cases with optometry, treat diseases. Mm-hmm. An ophthalmologist is a physician, an MD. An optometrist has gone to his own optometry school. So the basic difference is the ophthalmologist is the surgeon-physician, and the optometrist is also an eye physician, but he cannot do surgery. And at this point, some who have been certified can actually treat with antibiotics, glaucoma drops. Mm-hmm,
mm-hmm. Tell me a little bit about your practice. You are in Perth Amboy and in Edison, I believe, right?
Yes.
And how many partners do you have? A group of how many?
We have a group of 4 eye physicians, and my partner, Dr. Kenneth Darvin, is a retina specialist. Mm-hmm. And we have 2 fine optometrists, Dr. Galicchio and Dr. Avergon.
Well, tell me a little bit about what you're doing. Let's start off with something as simple as cataracts. What is a cataract? What are the treatments?
Well, a cataract is an opacity of the lens of the eye. The eye is like a camera, to simplify it. If you have a cloudy lens in your camera, you're not going to take good pictures. So a cataract is cloudiness of the lens of the eye. And what we actually do is remove that lens and replace it with a man-made lens. Mm-hmm. And this is where one of the most exciting things is happening. I've been in practice for 30 years, and at this point, my aim is to give my patients not only good vision, but the best vision they ever had in their lives.
Well, cataract surgery has come a long way, right? I mean, I remember cataracts 20 years ago, a lot of cutting, not rehab, but downtime. I mean, sutures, all kinds of stuff. You had to stop your Coumadin, you had to stop your thinners. We don't have to do that today.
No. Modern cataract surgery has gone a long way from wearing thick glasses, having an operation that took months to heal. We have gone to a very simple operation, usually taking in good hands less than 10 minutes, without injections, without stitches, without patches. We don't even stop the Coumadin anymore because we make our incisions in the cornea. And so you don't need to inject the patient to achieve anesthesia. You actually do it in the form of drops, anesthetic drops.
That's unbelievable. I still can't imagine, and I have to tell you this. People have said to me, and in fact, Travis and I were talking about this the other day at home because my wife was saying, you know what, I'd like to have LASIK surgery where they, I'd get rid of my glasses. And my older son said the same thing. Travis and I looked at each other and said, no way! I like my glasses. I can't imagine how you mess with the eye. That is just, it sounds, I don't know. I don't know what the word is.
It's true. Most physicians feel that about the eye. I feel that about the rest of the body.
Do you really? But, so when you talk about the heart, you go, oh man, no, I don't want to mess with that.
Exactly. But LASIK, for example, do not wear glasses. It's now such an advanced procedure. A flap is made in the cornea. This flap is no longer made with a blade, unless some doctors prefer to stay that way. It's actually made with a laser called interlace. Wow. And then a computer is used to not only determine the person's prescription, but analyzes the aberrations of their optical system.
That's amazing.
And at the same time, they actually treat that. So it's not only their prescription, but they end up with literally Zeiss binoculars.
I just can't imagine what you guys are doing today. And we also have to talk about this new lens that you're using for cataract surgery. That as you were telling me. But we're going to get to that, but we've got a couple of callers, so let's do that. Let's go first to Jean. Jean's in Middlesex, and I guess has a question for Dr. Santamaria. Jean, good morning, and welcome to Central Jersey 1450. How are you?
Thank you, Doctor. Yeah, I have shingles right now.
Uh-huh.
And you might want to tell your listeners they have a shot out now, a vaccine.
Right.
And it's covered for people age 60 and over. Yeah, by Medicare.
Uh-huh. Do you have an eye question, dear?
Yes, I do.
Go ahead.
I have dry macular degeneration, and my doctor wanted me to go for a test which involves injecting a yellow dye. Now, I'm allergic to a red dye. Would I have a problem with a yellow dye?
Well, likely not, Jean, but if it's truly dry macular degeneration, you may not need to have that more invasive test.
Oh, okay.
And a good examination may be sufficient. Also, there's an OCT scan now that is a non-invasive procedure to evaluate the macula.
Uh-huh. Oh, thank you so much, Doctor.
You're very welcome, Jean. Thank you for calling in, dear.
Thank
and have
you.
a wonderful day. A very happy holiday weekend to you.
You too.
What is macular degeneration, Dr. Santamaria?
Macular degeneration is a very common disease. It affects only one part of the retina, so a person never loses their vision completely. But that part is the most important part, the macula. Mm-hmm. And if it does, there are two types. The dry macular degeneration produces a long-term slow deterioration of the vision. Mm-hmm. But it can acutely change to wet macular degeneration, in which case an abnormal blood vessel forms underneath the retina, and that causes havoc with the retina. That's when a person gets a precipitous loss of the vision. But now there are treatments for both.
And there, because for many years we were taught and we were told that there is no treatment for macular degeneration. What are we doing today?
Well, for dry macular degeneration, in patients who are non-smokers, there are good reasons for that, the use of an AREDS vitamin can reduce the risk of advanced macular degeneration by 25%. It's not a great amount, but it's something. Mm-hmm. These vitamins were determined by a long-term study And that's an aspect that a doctor can determine if you're a candidate for that. Mm-hmm. But for wet macular degeneration, we have a tremendous advance at this point. We have an actual injection of a monoclonal antibody that stops the VEFAA. I won't bore you with the details of that, but it actually stops the enhancer of abnormal blood vessels. And that abnormal blood vessel that used to be treated with a laser in certain occasions now is reduced by injecting into the eye one of two medications, Lucentis or Avastin. And my partner, Dr. Darwin, has done a number of these. I'm so impressed with the success of this.
Now, you know, one of the things that I think we have to keep in mind here, folks, is that the advances that are happening with eye diseases in general are unbelievable. They really are. I'm speaking today, by the way, with Dr. Jaime Santamaria. Dr. Santamaria, folks, for those of you that don't know who he is, you better get out from under your rock, because he has been around, I believe he just told me, for 30 years in clinical practice, and is on staff. He works in the area in Perth Amboy and in Edison. He's on staff at Columbia. He's a part of the consultant network for Wills Eye Hospital in Philadelphia. That I grew up outside Philly. So Wills Eye Hospital was the mecca when it came to eyes. I mean, it's the place, is it not?
It still is.
It still is.
It still is. And now they have some 6 surgical centers. The northernmost one is in North Brunswick. That's the one I participate in. And the same equipment they have in Philadelphia, and just a wonderful place to operate.
Yeah, it really is amazing. We've got another caller, so let's do that for Dr. Santamaria. By the way, folks, if you'd like to speak about the eye, anything that has to do with the eye, what we're going to do is we're going to give you a phone number, and Travis is going to give that to you right now. What's that number, Trav?
732-545-9282.
Outside the 732 area code?
Just then, 888.
888, and then 888-545-9282. My guest once again today is Dr. Jaime Santamaria from the Santamaria Eye Institute right here in the Central Jersey area, Perth Amboy and in Edison. So let's go to Freddie. Freddie's in Helmetta. Good morning, Freddie. Welcome to Central Jersey 1450. How are you today?
Doctor, how are you doing today?
Great.
I got a question for Dr. Santamaria. Doctor, talking about eye diseases, what's the latest breakthrough on retinitis pigmentosa?
Well, unfortunately, there's not much.
Let's talk, what is retinitis pigmentosa?
Retinitis pigmentosa is an inherited disease that can affect the retina, the retinal pigment epithelium, and affects it from the outside in. So, fortunately, the last part of the vision that can be lost is the central vision, which is good.
Is it a progressive disease?
It's a progressive disease. It takes many, many years to progress. Mm-hmm. We used to look at that disease as 3 types, dominant, recessive, and sex-linked. Mm-hmm. Now we understand, incredibly enough, through DNA research and the human genome study, that there are some 60 enzymes that can fail, that can end up in that same disease called retinitis pigmentosa. So we are just opening the door to future cures for this disease, but it's a long way away.
That's unbelievable. That is absolutely unbelievable. Freddie, do you have any other question there?
Yeah, what about the Opticon, Doctor? Have you heard anything about that electronic chip that they're talking about?
Well, that's to enhance vision when there's vision loss, but, again, these are experimental things.
Right.
One of the things to be aware of patients with RP is that they can also develop cataracts, and that can affect their central vision, posterior subcapsular cataracts. So it's good to maintain a regular examination on all these patients.
Freddie, do you have retinitis pigmentosa?
Yeah, yes.
You do?
Yeah, I'm totally blind now. So.
Is that right?
Yeah.
So, and how long have you had this?
The first was diagnosed in 1975. It was progressive. Now, I went to, I don't know, did you ever go to, Massachusetts General, Dr. Burson, Elliot Burson up there?
He's well known.
Yeah, well, I was with him, I had an appointment with him in 1975. And they came up with 3 things. 1, it could have been hereditary. 2, it could have been too much sun. And 3, when I was a kid, all the atomic energy that they were testing back then, that could have had some effect on it.
I think it's mainly hereditary now.
It is mainly hereditary?
Yeah. Okay. I think the other 2 were speculations.
You know, the thing about it, though, not good. Thank God. Nobody in my family has it.
Good. Well, Freddie, I thank you for the phone call.
Right.
Have a wonderful weekend.
Okay,
God bless.
Thank
you. Take care. Dr. Santamaria, what can I say? You've just jammed up the phone lines. We've got a bunch of people calling in, so let's go to Sue in Edison. Good morning, Sue. Welcome to Central Jersey 1450. How are you today?
Good morning.
Good
Fine,
morning.
thank you. I have a question for Dr. Santamaria. Is there any age limit on cataract surgery? Any age limit on patients that you will do cataract surgery?
No. Today, we're doing it without injections, without a stitch, without a patch. The patient's not put to sleep. A minimal amount of sedation. We're actually talking with the patients. The operation is very simple. Takes usually less than 10 minutes in our hands. And we have done people who are 100 years old and older. As long as they need to see and they have the indications for surgery. It's affecting their daily activities of daily life. And so there is no limit.
No limit.
That is incredible. Why, who do you have?
No, my mother is like 88 and she needs it and she's afraid to have it done.
That's a very average age.
That's an average age.
Yes,
I remember when my grandfather had it when I was a little girl and he had to go in the hospital and they put bags on the side of his head.
Yeah.
And it was months, weeks, months. It was terrible. It was different operation then.
Now, these are the good old days.
The good old days.
Now.
You know what, Sue? Seriously, where's Mom? In Edison?
Yeah.
Get her over to, you know what? Have her...
Where are you?
Where's Dr. Santamaria? Where are you in Edison?
On the south side of the Menlo Park Mall.
Oh, over there.
He owns the whole mall.
No.
He owns the whole mall, yeah. Oh, yeah.
Good.
Yeah, his practice, his office is the whole mall. I mean, they're huge.
Oh, so you can have your eyes fixed and then go shopping.
Seeing what you're doing.
That's a good one. Seriously, you know what, Sue?
What?
What I tell people is if you're not sure of a procedure or you're nervous or anxious, and a classic example are colonoscopies. Who wants to have a colonoscopy?
Right.
Nobody.
Right.
Go talk to the doctor.
Go
At
to the
least
doctor.
go talk to the doctor. And this is obviously not like a colonoscopy, all right? Go take Mother in, and I guess Dr. Darwin would be doing that, right? Or do you do the cataract surgery?
I do the cataract surgery, but Dr. Darwin treats the macular degeneration, diabetic retinopathy, the retinal diseases.
Oh,
I
so
got news for you. You know what, Sue?
Yeah.
You take your mother in to meet this gentleman.
Uh-huh.
I'll guarantee you she'll be fine with it.
Okay.
Honest to goodness, he's a wonderful man. I can't even hear him talking. He's such a nice guy. You know? I mean, so you go take Mom in. Have her see him, and I'll bet you things will go. All right?
Thank you very much.
You're welcome.
Thank
Good luck for
Bye.
you. Happy holiday weekend. Take care. All righty, folks, stay with us. We'll be back in just a bit. My guest is Dr. Jaime Santamaria. I'm Dr. Derrick DeSilva here with you every Saturday between 10 and 11, speaking with you about your health. Back with you in just a bit. Central Jersey 1450 time is 10:36. Central Jersey weather is next.
Today, there are new treatments available for managing wet macular degeneration. Dr. Kenneth Darvin, the retina specialist at Santamaria Eye Center, with offices in Perth, Amboy, and Edison, now offers Lucentis for treating wet macular degeneration. Dr. Darvin is board certified and has personally performed over 4,000 laser procedures for treating diabetic retinopathy and macular degeneration. The Santamaria Eye Center is a progressive and complete eye center using state-of-the-art equipment and procedures to assess, diagnose, and treat your eyes. Make Santamaria Eye Center your partner in healthy vision. To learn more about your options for treating wet macular degeneration and the newest cataract implants Dr. Santamaria offers that allow you to see far and close without glasses, contact the Santamaria Eye Centers located in Perth, Amboy, Edison, and online at santamariaeyecenter.com. The Santamaria Eye Center. Excellent vision comes from excellence.
Central Jersey Talk Radio. Central Jersey 1450 WCTC. Talking with you all weekend.
Good morning, Central Jersey. Once again, I welcome you back. Great to have you with me. Trav, that was supposed to be your intro that you were supposed to do. So we'll do it next time. All right, folks, once again, welcome back to the program. My guest today is Dr. Jaime Santamaria. He does not need an introduction. He is an ophthalmologist. Their offices are in Edison and in Perth Amboy. Oh, Dr. Santamaria, what I don't have here is your phone number for people that need to contact you.
732-826-5159.
Once again, folks, 732-826-5159.
That has been the same number for over 70 years.
70? 70?
Yes, I took over the practice of Dr. Ralph Seal, who also took over the practice from his father. So that has been the same number for easily over 60 to 70 years.
That is unbelievable. That is unbelievable. Jeez. Anyway, let's go back to the phones and let's say hello to David. David is in North Brunswick. David, good morning, and welcome to Central Jersey 1450. How are you, sir?
Hi, how are you, Dr.
Good.
Santamaria? I have a question regarding the type of lens that you use. I heard that you could have, I guess, monocular versus binocular. Is that? I'm wondering if you use the newer type of lens and whether or not you and your staff have had training on that. I know it's relatively new, maybe been out a year or two. Just want to know what the status is of that technology and whether you incorporate that into your services.
You have asked me probably the most exciting question that anyone could have asked me, because in 30 years of practice, what we're doing now is the best we have ever done. Let me tell you about those lenses. The lenses that I use after cataract surgery, put at the end of the operation, in order for people to see. There are two types. Ones that give you only normal vision but no reading vision. But now you can have both. You can have distance and reading vision. Earlier models of this lens have been around for a while in very selected patients. I've been doing it actually for 6 years. Some of the early models called Arrayed, which are no longer made. But what we have now is the crystal lens, and I can't say enough good things about this lens. This lens gives you excellent vision for distance, and when you look at something close, it focuses.
It literally focuses?
It focuses. It accommodates. That's the actual medical word. You see, the ability to read without glasses, which many of us lose at the age of 40, or if you have glasses, you need bifocals at the age of 40. The muscles, the ciliary body that actually controls that focusing is still working. It's just that our lenses become very hard. Now, what this lens does, it takes those forces and uses it to actually do to this implant, move it forward a little bit and bend the forward surface to do the same thing that your natural lens does. So you're in focus for distance, intermediate, and in some patients, many patients, even reading.
So the lens actually does that?
Yes, it senses the forces which are still intact in your eye, even at the age of 85.
Now, I see. So the eye itself, the
Yes.
body itself, controls the lens?
Yes, the eye itself has the ciliary body, which does that focusing for close. Mm-hmm. And those forces have been working hard all the person's life, but the lens of their eye becomes hard, not pliable. And so it doesn't respond to it. But those muscles have been exercising, static exercise for a long time. So what happens is you look at close, and your brain controlling those muscles, move this implant slightly forward and bend the forward surface of this implant the same that your lens did, so that you can actually see not only distance, intermediate vision, your computer without glasses, go shopping, look at the name, but also close. It's incredible. I hear myself saying we put a number of them now, the happiest patients I have ever seen. That is incredible.
Now, is there an indication for this for other situations?
Yes, we're using it mainly for cataract surgery. Mm-hmm. However, patients who are over 42, 43, 45 that come in to have LASIK, or not to wear glasses, can have this lens done, because LASIK only gives them the distance vision or a compromise.
My wife will be there next week, I'll guarantee you. Look, we need to take a break. When we come back, we'll rejoin Dr. Jaime Santamaria. Folks, stay with us. We'll be back with you in just a bit. Central Jersey, 1450 time. All right, well, let's go back to the phones here. Dr. Jaime Santamaria is my guest. He is the ophthalmologist as far as I'm concerned. I can't tell you how many patients, Dr. Santamaria, we've mutually had over the years. It's just incredible how this whole thing has evolved and how this thing has worked out. So I thank you once again for taking your Saturday out to come in and spend here with us.
Well, it's a pleasure to be here with you, because I know you and I've seen your patients. You're a compassionate, caring person.
Well, I appreciate that, and I thank you very much for saying that. Let's go back to the phones, Dr. Santamaria, to Edison. And welcome Ann. Ann is in Edison. Ann, good morning, and welcome to Central Jersey 1450. How are you, dear?
I'm fine, thank you.
What can we do for you?
All right, I want to ask Dr. Santamaria, what's the difference between being born with cataracts, as I was, as opposed to acquiring them when you get older?
Totally different diseases. Congenital cataracts, if they are very dense, have to be operated on immediately. Otherwise, amblyopia or lazy eye develops, and then if they're operated later, they don't work. That's why initial evaluation, if the cataracts are not too dense, you really don't want to operate on them early. Totally different. You can have people with cataracts at any age, but anything after that, they're acquired cataracts. And of course, they're far more common.
What is the number one cause, or is there a number one cause for people getting cataracts?
Well, it's not known, but there's been a lot of theories. You were talking about the sun, in particular ultraviolet light. There seems to be some indication that can produce the cortical type of cataract. And of course, the sun itself can affect. And is it the oxidative damage that happens from the sun? Is that perhaps one of the theories here? It's perhaps one of the theories, even though the ARED study, the same one that determined that the vitamins were good for macular degeneration, did not show that the antioxidants, the zinc and the beta-carotenes that were used, prevented the formation of cataracts. It did not show that. So it's a very interesting question.
Interesting. And anything else before we run?
Yes. Mine weren't detected till I was 25 years old, and I'm now 70. And I think that's strange, but I also have macular degeneration, the dry type. I take excellent vitamins. I take the Purity Products multivitamins, which I think you're familiar with. I also eat a lot of green vegetables. I don't drink juice. I eat the fruit. Okay, so I have a good balanced diet. I eat fish, omega-3, et cetera, et cetera. So, I mean, I'm trying to do the best I can, but in spite of it, I have these both conditions. I mean, I can see okay. It's just that not as good as I used to, obviously.
All right. And thanks for the question. Any comment on that, Doctor?
Keep up the good work.
Yeah, that's exactly it. You got to keep. If not, you would have deteriorated probably a little bit earlier. Let's go back and let's see Helen. Helen is from Ford's. Good morning, Helen, and welcome to Central Jersey 1450. How are you, dear?
Fine, thank you, Doctor. I'd like to ask Dr. Santamaria a question. Sure. It'll be 2 years in August that I had my cataract operation, and ever since then now, every once in a while, my eyes get very blurry. Could that have been, is there something that has to do with the cataract operations? It never happened before until I had the cataract operation.
You need to have that examined by eye care professional, and we can determine why that would be. Could be many reasons after cataract surgery. Cloudiness of the capsule is a very common one. The appearance of another disease. In other words, once you've had the cataract surgery, you still need to have your regular care.
Okay.
Yeah, and that goes with that for everything. Just because you had a surgery doesn't mean that you have heart surgery. Does that mean that you had your bypass done? You've had the stents put in. That doesn't mean you can keep eating all the crummy food and start smoking again. So those follow-ups, that care, the preventative things, obviously all need to be done. Helen, thank you for the phone call.
Have
a marvelous weekend. God bless you.
Take
care.
Thank you.
Let's go to wrong one. Hold on a minute there. Let me do this. Okay, now let's go to Elaine in North Brunswick. Elaine, good morning, and welcome to Central Jersey 1450.
Dr. Santamaria, last summer I had the cataract surgery. I had the implants, and everything went well, but during the course of the surgery of the right eye, a blood vessel burst, and my eye was quite red for about almost 2 weeks. Well, now my blood vessels keep bursting in the right eye, I would say every couple of weeks, and they fade out, and then it does it again. And I have a good group. Could you explain why now that the blood vessels keep bursting in that right eye?
Are they affecting your vision?
Are they affecting your vision at all, Elaine?
What?
Is it affecting your vision?
No.
No. Usually these surface hemorrhages called subconjunctival hemorrhages don't mean much. In some study done in Great Britain many, many, many years ago, would never happen again, they actually admitted all the patients that had subconjunctival hemorrhages at Moorfields Eye Hospital, checked them for every disease known to man, and they found no increasing association with any particular disease. So they're usually inoffensive, they're somewhat embarrassing, they look terrible, but usually they don't mean anything.
Elaine, do you take any aspirin, blood thinners?
I take Voltaren, an anti-inflammatory, but I take no aspirin.
Well, could Voltaren be doing this?
Sure. Just rubbing your eye the wrong way, just straining, just lifting something heavy can do that. But it's usually on the surface. Subconjunctival hemorrhages usually don't mean much.
Okay.
I know But it looks terrible. Am I going to have this for the rest of my life?
Well, I mean, again, as Dr. Santamaria said, dear, difficult to say. Follow up with your eye doctor. It doesn't usually mean anything. And I would say, you know, I mean, again, I'm not an ophthalmologist, but anything that thins the blood, that makes the blood vessels a little bit more friable.
Right.
You're not rubbing your eyes at this point because it's allergy season, are you?
No, I'm careful about that.
Okay, just be careful with that. Good luck to you, sweetheart.
Thank
Have a great day. Take care. Let's see if we can get May in very quickly from Edison. May, good morning and welcome to Central Jersey 1450. How are you, dear?
Very well, thank you.
Question.
My question is, what can be done for double vision?
It depends on what's producing the double vision. Sometimes our muscles relax and the eyes take a certain position. Sometimes prisms can be used to correct that. Double vision can also occur through neurological diseases, paralysis of one of the three cranial nerves that control the muscle movement of the eye, the third, the fourth, and the sixth. So you really need to get that checked, and if it's just as simple as using a prism in your glasses, that's fine, but it really should be determined and checked.
Have you been to the eye doctor, May? Had this checked?
No.
Well, what are you waiting for?
I don't know.
You're seeing double. Are you married?
Oh, yeah.
Are you seeing your two husbands? You don't want two husbands?
Oh, I keep one closed.
Oh, God, one's enough. One's enough. Right. Go get your eye checked. What's the matter with you?
All right, I will. I've been carrying his number around for a long while.
Well, carrying his number doesn't make your eye better.
I know.
Okay?
Thank you.
Listen, 732-826-5159.
5159.
Do it.
All right.
Take care.
I cut that big item out of the paper, too.
Well, give him a call.
All right.
Good luck to you.
Thank you.
Have a great day. I carry his number around. Well, that doesn't make your eye better. Dr. Santamaria, thank you so much, sir.
You're welcome.
It's a pleasure to have you here. Keep up the wonderful work.
Thank you. An honor to be here with you.
Thank you. And my best to everybody else in your group, Dr. Darvin and everybody else.
Thank you.
Thank you. All righty, folks, 732-826-5159 is his number. Travis, closing comments before we get out of here. Thank you very much for joining me. God bless you all. And until next time, I'm Dr. Derrick DeSilva, and may you always be blessed with good health.